Thank you all for being here today. I thought it was really important for MVHS as the local healthcare provider to give you an update on everything going on in our organization. First, let me say, at this point, we do not have any confirmed cases in our facilities, in any of our facilities. That can change with a moment's notice, but at this point, we have no confirmed cases. That said, though, we are putting a lot of restrictions and precautions in place. After a very busy weekend, on Monday morning at 9 a.m., we implemented our Incident Command Center. This is an emergency response system that we drill on regularly, hoping that we never have to use it. Unfortunately, in our community at this point, we did need to implement the Incident Command. Up until this point, we have also implemented many restrictions. We have visitor restrictions in all of our facilities. We have no visitors at all allowed in our long-term care facility, RNC, which is located on the St. Luke's campus. No visitors have been allowed in that facility since last week. We also require every employee to be screened every morning as they come into the long-term care facility, because those are the patients most at risk. We have restricted entrances into our building, and because we have also restricted visitors, we have security guards at each of our entrances, making sure that we're limiting the number of visitors and the potential for contamination. We've closed our cafeteria to visitors. We've eliminated salad bars and soup bars. And we've also even thrown out the salt and pepper shakers. We have developed pathways for our patients to come through the ER or through any lobby to ensure that if they are sniffling or at risk, that they are kept separate from other patients and our employees. We've been training and educating our staff in all areas on the proper use of PPE. Our priority have been those areas that are most in contact with the patients. We've also asked our volunteers to stay home, even though they're very dedicated and want to come to work. Many of them are older and could be at risk themselves. We've eliminated all unnecessary non-emergent meetings, and we are not holding any meetings that include more than 10 people. In those cases, we are calling in and having conference calls. We've also eliminated our board meeting together, and we are holding our board meetings telephonically. We also have travel limits for our employees, and for those that have traveled, there are checks when they return to ensure that we are not bringing any exposure into our facility. So areas that we're focused on and concerned about: supplies and people. We're just like every other hospital across the country. We are monitoring our employees and our supplies. We have physicians doing development plans in their specialty areas. We have a labor pool that we are pulling together, being managed by our HR department. When the school closed on Fridays, we had additional concerns about employees being out because of the lack of daycare. So we are getting volunteers for daycare. We're working with the county for daycare and are managing those requests from our employees through the HR department. We also are concerned about dwindling blood supplies. We are fine right now, but with people staying home and not donating blood, it can quickly become an issue for the American hospitals. So we are working with the Red Cross to hopefully do a blood drive soon. We have not yet canceled elective surgeries. We'll probably talk a little bit more about that. We expect that that will be a dictate coming from the state any day now, but we are still doing surgeries. We yesterday established a drive-through test screening location on Burstone Avenue. It's been open from 11 to 3. We did a soft opening yesterday to work out the bugs of our process. Patients must be referred by a physician. They cannot self-select or just show up. So as we've been saying for the last 2 weeks, if people are concerned, they have symptoms, they need to call their physician and get a referral to that testing site. And that is a process that's necessary so that we can preserve the supplies that we have and use them for the people who are most at risk. Let me see if I have any other important points. Again, we've been telling people, I don't want to disrupt this, to call their doctors, not go to the doctor's office, not to go to walk-in centers, but to first call them. Do not go to the ER unless they are so sick they need to be in the ER. And that, again, is to decrease the opportunity for exposure. We are obsessed as an organization and as healthcare leaders with cleanliness, washing our hands, keeping our areas clean, and exercising social distancing. And for an organization that's pretty social, this is hard, but it is really important that we all keep our distance from each other. We also are concerned about the long hours and the stress that healthcare workers are placed under in times like these. So we are asking our staff to tap out when they're tired and they need a rest. And if they don't do that, then their supervisors will require it. So we are urging all of our community to stay home if you're sick, to wash your hands frequently, cover your cough if you sneeze, and clean all the high-touch areas in your offices or in your homes, and to monitor your systems. Most of all, it's important that we all stay calm, and we believe that if, as a community, as a state, that we all do what's the right thing to curtail the spread of this virus, we'll be able to get back to our coveted lives as soon as possible. Now with that, I would like to introduce Dr. Kent Hall. Dr. Hall is the Chief Physician Executive for the Mohawk Valley Health System.